Hi everyone, it's Dr. Margaret Gani. Welcome to my YouTube channel, Dr. Maggie Prevents, where I share my experience of attempting to transition from a mostly clinical psychiatry career to a more preventative mental health based one. In my last video, I talked a bit about how I was doing some things with the Royal College of Psychiatrists, and I think that's related to some reflections I've been having recently or for a while now about how I can integrate the things I'm interested in and I'm doing with the organizations I am involved in, and how I can, eventually somehow figure a preventative mental health pathway through it all. I hope that makes sense to you. Um, I live and work in the UK and I trained as a consultant psychiatrist here. However, at some point as I was training to be a psychiatrist, an opportunity came up to also train as a cognitive analytic therapist, which I took. And I have recently had it confirmed that my accreditation is complete and now I'm a fully accredited cognitive analytic therapist. Now, I have been thinking for a while, how do I integrate this with what I'm trying to do? And I'm still figuring it out. However, something that is dear to my heart is I am passionate about optimizing mental health. Obviously, that's why I'm doing this. And I do believe that cognitive analytic therapy is one of the modalities of therapy where the principles can be, adapted to a preventative mental health model or to preventative mental health approaches um, somewhat seamlessly, potentially. Now, just for those who haven't heard me talk about cognitive analytic therapy before, we typically shorten it to CAT. So if you hear me talking about CAT or CAT therapy, I'm not talking about an actual cat. I'm talking about CAT therapy. Now, the cognitive part of um, CAT deals more with the here and now and helping you figure things out in the here and now. The analytic is more exploratory into your past and what's happened, and that's how it's linked to what you're experiencing. And ultimately, we hope with the principles and the tools we support you with as you go through therapy, we can impact your future. So you have better outcomes. Your life is more fulfilling. Your mental well-being is in a better place as a result of going through however many sessions of cat therapy a person might go through. But more recently, like I said, I've been thinking about how we could or I could potentially integrate preventative mental health and cognitive analytic therapy approaches and principles to, support people. Um, you might have heard that I have also recently founded a mental well-being consultancy, and I think that is one of the ways in which I might potentially be able to take that angle of things forward, because the mental well-being consultancy, we hope to work with individuals, but also with educational and healthcare organizations and even with corporate organizations. And the idea is that we help people and groups figure out how to optimize their mental health before it becomes a crisis, right? I have worked across the spectrum in psychiatry and clinical psychiatry. I've worked with people on long stay psychiatry wards, on acute psychiatry wards. I've seen patients in psychiatric intensive care units in the accident and emergency. And a person's mental health can deteriorate really badly if the unfortunate, stressors are in place or if there are other reasons that could lead to that. However, I and many others believe that if we are able to intervene earlier in the mental health cycle, then the person is less likely to go on to, be that critical when they present to us, or it could even stop them from presenting to us. And so I've been thinking, okay, how do we, you know, integrate cognitive analytic therapy principles, which include things like reciprocal roles, exits, and a number of other terms that I won't go into today, with preventative mental health. But I think I'll conclude this video by saying it's something I'm figuring out, right? I think I've tried to be open in these sets of videos that it's a journey for me. I am learning, I'm growing, I'm evolving. I'm also making peace with the learning process. When I started, I didn't really want to do YouTube videos, but here I am, learning something new and, putting myself out there and, growing every day, hopefully. And so I am, trying to keep an open mind about integrating, the cognitive analytic therapy principles, which can be very beneficial for a person's mental health and well-being with preventative mental health, and seeing if we can offer services for people before they start to deteriorate that integrate those principles of cognitive analytic therapy. Then we can optimize people's mental health. Another way, or related to that, I am also trying to see if I can work with one or two of the cognitive analytic therapy organizations I know to think about preventative mental health within therapy. And I'm also trying to link up with psychologists and people in that, sphere to think about prevention, because there are people that are interested in that and working towards that. All that to say, I do not belittle the value of acute clinical care, but I do think we should start to think about intervening early to reduce the costs and the outcomes if we don't. I think I'll stop here because I'm trying to make my videos not too long. I'm not sure I'll succeeded this time. But remember that the videos do not replace clinical care. If you're struggling with your mental health and well-being, or even your physical health, please reach out to a specialist or your primary healthcare provider in your local area and get the help you need, right? Also remember that prevention saves lives, and that includes mental health prevention, and together let's optimize our mental health. Thank you for coming on. See ya.